If you've had a lung transplant or are currently awaiting a lung transplant, the COVID-19 pandemic raises some important points for you to remember. For both groups of patients, you must remember to follow the Public Health Agency of Canada's recommendations for staying at home as much as possible and only leaving the home for essential reasons. You may want to consider having trusted friends or family to pick up your groceries and go out for your medicines. If you must leave the home, to remember to practice physical distancing and stay at least 2 meters or 6 feet away from the next person. You should also consider washing your hands on a routine basis for at least 20 seconds with soap and water or using hand sanitizer. If you've had a lung transplant, there are some specific things that I would recommend. One, to stay in very close contact with your transplant program. They're going to be the most up to date in regards to how COVID-19 is evolving and how it affects you. The second thing is to remember that because of the medications you're on for your transplant, you're at a higher risk in general for acquiring infections, whether it be COVID-19 or something else. So knowing that, I think it's really important to remember that staying at home is the best bet for you to stay as safe as possible. If you develop any symptoms, especially respiratory related symptoms, it's important that you contact your transplant program immediately. I'd also recommend that you continue to exercise routinely. That might be challenging given the fact that you can't go outside the house. So again, speaking with your transplant program about exercises that you can do around the home and perhaps looking online for various programs that might assist you for exercising within the home would be reasonable. At this time, there's no current recommendation for everyone to wear a mask when they leave the house. However, you represent a very unique patient in the sense that you've got medicines that suppress your immune system. So again, speaking with your transplant program about the potential use of a mask when you leave the home would be recommended. If you're currently awaiting a lung transplant, the recommendations remain the same. Because you live with a chronic respiratory condition, it's highly recommended that you stay at home as much as possible. Again, if you do need to leave the house, you would want to practice physical distancing. I think the most important thing for you is to keep in touch with your transplant program, as in the pandemic, we are currently responding in real time to the situation and whether or not transplants can move forward or not. So keeping in touch with your transplant program that's assessing you is critical during this phase.